Hello, this is my presentation, You Have a Story to Tell, a guide to writing case reports. My name is Jason Brummett, and I'm an assistant professor of physical therapy at George Fox University. This presentation was first provided at the 2018 Oregon Physical Therapy Association Annual Conference. So why this presentation? Well, you can contribute to our profession's knowledge base and potentially influence future research via writing case reports. So in your clinical role, working with patients day in and day out, you're positioned to help change practice. So what are case reports? Case reports are the stories about our patients. They are stories about the therapy services that we provide, and they are stories about real clinical situations. Now, case reports can do a few different things that I have listed here, but let's take a look at the next slide where we've got some images to really illustrate these points. So first off, case reports can model evidence-based practice. Case reports are evidence. They're the lowest level of evidence, but they are evidence, and it's an important first step in suggesting hypotheses for future research. Case reports can also persuade or motivate other practitioners. They can convey experiences to other clinicians. And they can provide material for teaching and learning. Now, case reports can highlight things like unique clinical problems or challenges. As I was preparing this presentation, I came across this recently published case report, Manual Therapy and Exercise for a Patient with Neck-Tongue Syndrome. I had never heard of neck-tongue syndrome before and immediately went to PubMed and performed a search. Only 34 citations came up, and not all of those were related to the actual syndrome of neck-tongue syndrome. So it's a condition that is not well known. I wasn't aware of it. And so case reports can highlight these unique clinical problems. Case reports can also highlight common problems or challenges that are not addressed in other forms of the literature. They can address differential diagnosis, processes for decision making, community interventions, and ethical dilemmas. Case reports are these stories about our client and the information about the outcome from the therapy services that we provide. Case reports are not single subject designs. There's a difference between the two. The case report is where I've got my patient, I'm collecting information about that patient, I'm providing an intervention, everything is non-experimental in nature, and then I'm reporting about the outcome for that individual. A single subject design is where I've got a client, and I'm going to be doing something experimental with that client. Since it's a research study, it's actually a subject and not a client. We collect information about that individual at baseline. We provide an intervention. We assess and take measures again to see how the intervention has impacted the person. And then we remove the intervention and then see, did that individual stay the same, or were changes occurring? Did changes occur where they return to their baseline again? Now, a classic example in research for a single subject design is looking at how a medication can impact an individual. Single subject designs can sometimes be seen within physical therapy or other rehabilitation sciences, but more often than not, when we think about single subject designs, it's those classic kind of drug studies. Here are a couple titles to illustrate differences between case report and a single subject design. The case report there is one of the ones that I published, looking at an in-season rehabilitation program for a Division III female wrestler after a glenohumeral dislocation. So this case report was unique because it focused on a female wrestler, a sport which has a lower percentage of individuals of the female gender participating in it, and then detailing her rehabilitation program, allowing her to return to sport and compete in the national championships. On the other hand, the single subject design, oftentimes it'll say it within the study title, in this case, exploring the effects of using an oral appliance to reduce movement dysfunction in an individual with Parkinson's disease. a single subject design study. And even if the title didn't say something about a single subject design study, you would be able to read the article and determine that, because oftentimes, again, there's that removal of the intervention to see how it impacts the patient. In the case of the case report, there's no removal of the intervention. There is only the intervention strategy employed. Now, there's also something called a case series. Case series is a collection of case reports. So you've got a common problem or challenge, and then you write up about several different cases, and you can compare and contrast those and highlight how the intervention worked for these individuals. Here's a case series example that has been very influential through the 2000s. Now, for patients with patellofemoral pain syndrome, historically, therapeutic exercise targeted weakness in the quadriceps. Well, this study, this case report study, actually case series, published by Maskell et al. In the 2003 Journal of Orthopedic and Sports Physical Therapy, found that addressing muscular weakness in the hips or the core region also helped with the individuals recovering from patellofemoral syndrome. So this case series conveyed experiences of its authors. It was helpful in motivating physical therapists to assess and treat hip weakness in this population. And this case report, or I should say case series, suggested hypotheses for future research. And then we see that playing out over the 2000s, and then recently in a 2018 edition of the Journal of Orthopedic and Sports Physical Therapy, this systematic review with meta-analysis was published. And it was comparing studies that looked at hip and knee strengthening versus knee strengthening alone for reducing pain in patients with patellofemoral pain. And the authors of this systematic review concluded that hip and knee strengthening is effective and superior to knee strengthening alone. So that case series went on to have a big impact in motivating or driving others to do research in the area. And then this particular systematic review then summarized or analyzed all of those studies out there and found that hip and knee strengthening is more effective. So it really helps to drive and change practice. So what are the strengths of case reports? Well, in a case report, there's depth of detail, richness of the information. Since there's a lot of it, you can really go into more and more about that individual in the case than you would ever see in a randomized controlled trial or in a quasi-experimental type of study. There's also a focus on individual differences. Case reports can highlight unusual successes or failures, and case reports can present individualized interventions and services. Now again, case reports are evidence. They are in the hierarchy of evidence. They are the lowest form, though, with a level 5 score. Now, there are lots of reasons to write case reports. First, share ideas. That's very important. Also, learning from the process. By writing a case report, you are going to become an expert in that area because you're going to be spending time exploring the literature that's out there already, reviewing that, citing that literature in your paper. It's going to transform you and make you become a better therapist or whatever clinical specialty you're in. It'll help to promote the profession. It's also sometimes nice to see your name in print. It can potentially be used as collateral materials in marketing to promote your clinic. You know, you could take that published case report to a potential referral source and say, hey, here's some of the things that we're successfully doing at our facility. And then it could be something that is added to your resume. The job you have now may not be the job that you want 5 years from now. And so by having that on your resume, that shows your expertise or your scholarly ability. Now, people come up with reasons not to write or publish a case report, and hopefully I can dispel some of these. First one there, no time, no time, no time. Well, nobody has time. Our lives are very, very busy. But I bet if you look really closely at your schedule, there's areas in your life where you could fit it in. For example, at nighttime, do you have one night a week where you could spend an hour or two writing? Most people can potentially fit that in. And remember, this isn't like a term paper. You're not having to meet a deadline from some faculty member. You're not trying to get that in before the end of the term. You're working on it and trying to complete it when you're able to get to it. The next one here, real clinicians treat patients. Sometimes people will have an attitude or an arrogance about them that, oh, I don't have time to do that stuff. I'm too busy treating patients. I am taking care of all of these individuals and I've got no time. I just have no time to be able to do it. Well, my argument would be a clinician that takes the time for self-reflection is going to be doing more good for their patients in the future. Because how do you know that the treatments that you are utilizing are really effective for that patient if you don't take time to review cases and to reflect on how somebody has improved over time or maybe not improved over time? Next one, editors and reviewers are heartless. So you'll hear that sometimes from researchers that they hate the process of submitting a manuscript and then getting back the reviews and feeling like their paper was unfairly criticized or critiqued. As a researcher, sometimes the reviews I get back can seem heartless. And that's partly because of the double-blind process. They don't know who you are and you don't know who they are. But the good news is, when you write a case report, the reviewers realize and appreciate that and don't scrutinize it to the same extent that they would scrutinize a randomized controlled trial, because they realize where the case report fits in the hierarchy of things, and so it is, I think, a much nicer process. Next one, it takes forever to get published. You'll hear people complain about that like, why would I want to do that and then wait 2 years for it to come out, or this and that, whatever complaints people come up with. Well, in reality, once you've submitted it and once it gets accepted, yes, it's true, it may take 6 months to a year for it to get in its finalized print form. However, most journals are competing now to try to get information out sooner. And so once something has been accepted and it's gone through the editorial process, as soon as they've got it completed and proofread and spelling check and all that stuff, they try to get it online as soon as possible. And so you will be able to access it immediately almost, compared to in the past where people had to wait that year period of time before it actually came out in print form. There's also open access journals. Open access journals don't have the same time delays because they just put everything on the web. And you'll see sometimes open access journals describe a 30-day process where once it is accepted, it's published online within that period of time. And they really try to pride themselves on quickly disseminating information. That can be another way to go too. Challenge with open access journals is sometimes it's a little bit more expensive to get things published because they don't have funding from professional organizations that support the journal, and so they may charge anywhere from $250 to $1,500 to get that paper published. The traditional journals, there is no cost associated with that. Next one, colleagues will be critical. And I don't know why a colleague would be critical of you doing scholarly work. I would just say ignore those individuals, and more than anything, if somebody's being critical, it's probably because they're just jealous that they didn't do that work themselves. Another reason that people will say that I don't have time or I don't want to write a case report is because they feel like they don't write very well. And the truth is, people don't write very well in general. I do a lot of reviewing of articles for journals, and these manuscripts that are submitted by individuals with PhDs or advanced scientific training, oftentimes they are filled with grammatical errors, spelling errors, things like that. And so just appreciate that even though you may not have written a scientific paper before, or you're out of practice with writing, don't let that be something that limits you or holds you back from trying to write and to publish a case report. Next one, people will suggest, I don't want to do a case report, no one would be interested. Well, in reality, if it's potentially interesting to you, there's potentially thousands of other clinicians that would have that interest in that case report too. And then finally, you won't get paid, and that is true. You do not get paid for publishing a case report. However, there may be some very positive ramifications or outcomes as a result. For example, again, it could be used as a collateral material for marketing purposes to potential referral sources, which would ultimately help out your business. People identifying or seeing your case report may come to you to speak on a topic, which may provide you an honorarium or an opportunity to do continuing education. So there are definitely ways in which it can enhance you or benefit you economically. All right, let's take a look at the components or the anatomy of a case report. First thing is the abstract. The abstract, that brief summary of the report's content. You can kind of think about this as the elevator pitch. This is a way to get the reader's attention. So you see the title, and oftentimes clinicians will do this. They'll read the title, they'll see that it's a case report, and deciding whether or not they read the whole article, they scan over the abstract. So again, can you get the reader's attention? Can you write something that will grab them? Now, usually you would write 1 to 2 sentences summarizing each section of the abstract's outline. And I have an example here from one of my case reports. It's important, though, that you format specific to journal guidelines, and you can always find the guidelines for what should be in the abstract, as well as the different sections of a particular case report on that journal's website. Now, my recommendation is to write your abstract last after you've completed your initial draft, because you may be able to cut and paste some key sentences from your text and put it right into the abstract, or I should say, after completing your paper, you've got a really good sense of what your case report is about, and that's going to help you then to detail in 250 to 300 words what your abstract should be. Next, as we get into the text itself, is the introduction and or background section. And this section helps place the report in context. It is the explanation, your explanation or your purpose for writing the report. So here's an example from something I published, a case report looking at returning to running for a postpartum client. And while this is not the entire introduction section, I just put a little component of it, the first paragraph here. This section goes into detail on epidemiology, so exercise habits of women pre and postpartum. There's a discussion in there regarding research that looked at lack of activity after delivery and that contribution to women becoming overweight or obese. Also a discussion on the American College of Obstetrics and Gynecology, their guidelines for exercising after delivery, where they have a lot of information on the vaginal birth, but not a lot on what women should do once they've had a cesarean section. And then, of course, there's a purpose statement. So the purpose of this case report is to detail the blah, blah, blah for a postpartum client as she attempts to return to running. Next up here, the theoretical framework, and this is not often its own individual section. It is something that is typically within an introduction section, and it's where you summarize the pertinent literature. You identify gaps in knowledge and describe the theory supporting your examination and intervention approach. Next section is the patient description and history. And this is where you're describing your patient or your client. You're telling their story. You want to provide as much detail as possible. Again, depth of detail, richness of information. As the reader understands your case, your client or patient, they can then appreciate clients or patients in their professional life who are similar to that. This section also summarizes the patient's or client's concerns and the reasons for seeking intervention. The next section is the examination and evaluation section. So here's where you're describing the examination strategies and tools used. Are they reliable? Are they valid? What's the sensitivity and specificity of any of the tests and measures that you use? You will detail the findings of your exam and then relate your clinical thinking and decision making as you proceed through the examination. I have illustrated here a component of my physical examination section of one of my case reports. And I start off with the standing examination because this was for a runner who was iron deficient. And then I describe everything that I do in the standing examination and then transition into sitting examinations and as well a examination on the table. And then in this section, you'll also summarize your judgments and conclusions about the findings. It's also really good, and we'll talk more about this later on in the lecture, to include tables and figures to illustrate findings from the patient examination. Next, the diagnosis and prognosis section. This is where you state the patient's different diagnosis, whether this be the medical diagnosis or your physical therapy or occupational therapy related diagnosis. If possible, provide data. Were medical tests used to help in creating the diagnosis? And that can be great then to go back to the referral source and to get that information. It's really easy. All you need to do is get the patient to sign a medical release form. Here I've got a list of different tests that were performed and the dates for a patient who was iron deficient. This was a collegiate athlete who was having a lot of musculoskeletal related issues. Her iron deficiency state was missed by numerous practitioners. And then finally, an MD identified that she was probably iron deficient and did complete blood count. And we see those scores and we're able then to follow them over time. So that's some really impactful information to highlight or to demonstrate her problem. In the diagnosis and prognosis section, you also want to state your time-based expectations for outcomes and consider the impairment function performance, activity, and participation levels. Next, intervention. So describing your treatment plan. Provide a detailed timeline. Describe any changes you made from the original plan and why you did that. Describe the patient-client's response. And describe interdisciplinary efforts and factors external to the intervention plan. And then here's an example of how I laid out a timeline in a paper within the different treatments that I performed per sessions. Here's another example of a list going through the protocol that I used when working with the patient who was the female wrestler after she had had a glenohumeral dislocation. Any re-examination, re-evaluation findings should be listed. You want to detail these findings and summarize your judgments and conclusions about them. And then compare the findings of your re-examination to your original findings and your original prognosis. And then in the paper, there's a discussion conclusions section. So this is where you can identify special issues associated with the case. You can explain why the report is important or interesting, discuss insights in retrospect, discuss limitations, and discuss potential implications. So this is where I discussed with this patient who was a cross-country runner who was iron deficient. I highlighted her 2006 times versus her 2007. 2007 is when she was being treated for her iron deficiency, and I was working with her to address her musculoskeletal complaints. And you can see that she had improvements year to year, culminating with being able to participate in the last two events, including those events being the district and the national events, and the times that she was able to achieve, and discussing that she was able to earn All-American status. Now, I'm not attributing my musculoskeletal treatments to her overall success. I really think the iron supplementation and the treatment by the MD really helped to allow her to be able to compete and be successful, but it really illustrates how she had improvements, and it really puts a nice bow on your overall case report package. Now, communicating your case. Where to begin? Who is your target audience? If you're working in orthopedics, obviously you're going to be wanting to target your paper towards the orthopedic and sports groups. Or if you're pediatrics, targeting things towards pediatric populations, knowing who your audience is, and then identifying journals that may be potentially interested in your case report. So sometimes you just go to the journal websites and look to see if they accept case reports as one form of manuscript. And most of them do. Next, if you're going to write a case report, I suggest constructing sentence outlines. So create an outline of the different sections that would be in your case report, and this is oftentimes dictated by the journal, so you want to see what their formatting is. And then start just writing some sentences. Write the first sentence for each paragraph. And then from there, you can build paragraphs around those. Recognize that subtitles are valuable. So for example, in my examination section for the patient who was iron deficient, I discussed a standing examination because I wanted to see how she moved functionally, what her squat looked like, what her lunges looked like, to get a sense how well she was doing with proximal stabilization. Then I went into a sitting and then a supine and prone examination. So subtitles can be very important and very relevant. So include those into your outline. And then grammar-wise, obviously we want to write good sentences. We want to have proper grammar. However, don't get so blocked with your writing that you're having challenges getting through your manuscript. I would suggest just letting your hands type away, get everything out on paper, and then go back and revise later. So don't slow yourself down by editing in your head. Get it onto the paper and then edit it later. Now, let's talk about graphics, images, figures. Very important, right? You've heard the saying, picture's worth 1,000 words. And pictures, graphics, they are so loved by journal editors. Very important for case reports. So, use of graphics. All these different things could or should be used in a case report. Photographs, probably the best. This comes from a case report looking at another recreational endurance athlete who was having low back pain. She was experiencing a Trendelenburg while running. There were some other biomechanical faults. She had weakness in her core muscles. And then I was able to illustrate some of these things by not only demonstrating some abnormalities with doing some pictures, but also illustrating different tests that I use. So in this particular paper, utilize the Bunke test. The Bunke test, a series of 5 different tests that were assessing core muscular endurance function. For photographs, zoom in on detail, limit distractions. So I put this picture in here on purpose because it focuses on the exercise and it doesn't have any distractions in the background. This was actually published in a not in a case report, in a different paper that I did, but originally we had some marketing imaging or marketing images, logos, things like that in the background, and the journal asked us to take those out. And so that's important. You want to have black or blank backgrounds. Again, look at the journal recommendations or the requirements for labeling, providing legends, things like that. Photo credits only necessary if it comes from somebody else. And if you're getting something from a different journal, remember you need to get written permission, and oftentimes that costs money too to use somebody else's picture. So if possible, just take your own. Diagrams can summarize or graphically define theoretical framework, explain the mechanism of an intervention, or describe a clinical pathway or a care map. Here's an example of a diagram illustrating a theoretical framework. Timelines. These help outline the course of an intervention over time, clarify critical time elements in episode of care, and track progress of patient across care settings. Here's a timeline example. Tables, very important. They report measurement data, they report the response to intervention, and they define intervention parameters. Here's a table from one of my case reports looking at golf performance in an individual who was 11 months post-rotator cuff repair. For tables, keep it simple and clear. Provide a key for all abbreviations. You can see that listed here in this particular table. Use lines sparingly. I think journals prefer to see something like this as a table versus something like this. Clearly label columns and rows, provide an explanatory title, and number consecutively. Lists used to describe intervention protocols and activities. I showed an example of one a little bit earlier. Lists also detail goals of intervention. They list patient impairments and are used to highlight important points. The use of lists alone or within tables can be done. The use of lists, they should have a consistent format to them and keep them simple and to the point. Line graphs. Line graphs can show change over time, track the progression of an intervention, and track outcomes. Now, I don't see line graphs as often in case reports, but it could be something that could be very valuable. So like, for example, in this case, comparing changes in pain between the right knee and the left knee. Bar graphs. Another thing that I don't see used as frequently in case reports, but again, could be a very nice tool for illustrating change. Here's, and I'm not going to read through these, but just different things you want to consider if you were including a bar graph in your manuscript. References. So at the end of each journal article, there is a list of references. You want to follow the style required by that journal. So a journal will either require AMA or APA format. And to learn how to do those, you can Google it, or you can also just look at another article, a sample article online for that journal, and to see how they have things laid out. Now, when it comes to presenting the references within the text, there are some differences. Sometimes superscripts are required. Other times, the journal may want you just to list the number, not superscripted, but have it like number 1 in parentheses. And then for international journals or journals using APA format, they typically want to have the last name of the first author and sometimes additional authors listed too and the year. So for example, Brummett et al. 2009. Now, if you have some reference management software, that can be a nice way to help control and order your references. But if you don't, and I wouldn't expect that you would as a clinician, what I typically will do is if I write a sentence that needs to be cited, at the end in parentheses, I'll put the last name of the first author, the abbreviation of the journal, and the year. And then that way, then when I get done with my manuscript and I go in to put in the superscripts or whatever is required by that journal, then I'm able to match things up and create my reference list in that way. For the submission process, you want to follow the instructions on the journal website. Before you submit, I'd ask a colleague to review it. Take a look at it for grammar, spelling, to see if things make sense. Sometimes something that we write may make sense to us, but that's because we're too close to it and we're having trouble editing ourselves. Somebody else may see a paragraph and go, wow, that doesn't make any sense at all whatsoever. And that would be some great feedback, because the more of those minor things that you can take care of, the better. I've been frustrated at times doing reviews of journal articles, because if there are so many errors, sometimes I just don't want to continue on reading, and will then just send the paper back to the editor saying, this needs a lot of revision before we can even start to understand what it is about. Also, things like figures and tables, those are oftentimes uploaded separately. So look at what the instructions are for the journal. Release forms, typically you don't need those, because since this is non-experimental, and typically you don't want to include any identifying information about the individual, right? It's okay to say patient was a 34-year-old female clerical worker who was a recreational runner, but you wouldn't go on to say who lives on Main Street in downtown Portland and has brown hair, right? So the individuals are anonymous in that sense. However, if you were to use a figure that showed any part of that individual's body part or their face or anything like that, then you would probably need to get a release form signed for the picture use. You can always get around that by just taking a picture of somebody else or of yourself and including those pictures, like if you're trying to have some pictures of some specific exercises that you would include. And then the cover letter is always important, because in the cover letter you're introducing yourself and your paper to the editor, and highlighting a couple sentences why your case report, why you think it is important. Because it's always great to get the editor on your side, because you may have a case report that the reviewers say, this isn't publishable, and they reject it, but the editor finds enough value in it and still accepts it. So the review process, once you've submitted and uploaded your article, it's received and assigned to an editor of that journal. And then it goes through a blind review with at least 2 individuals reviewing it. You'll get back a summary of reviewer comments. How quickly that will occur depends upon the journal that you send it to. It could be as quick as 30 days. It could take longer, up to 90 days. So then you are going to respond to those reviewer comments. You're going to revise. So if they say, hey, major revisions are necessary, please revise and address the reviewer's comments, what you would do is look at the reviewer's comments. If their comments look like something that would be appropriate to change or to make a comment on, then do so. So for example, if I was writing a paper and it said, you should include references by this source and integrate that into your paper, then I could very easily say, thank you very much for that recommendation. I have included these references. Hopefully that helps to strengthen that section. Something along those lines. If you disagree, it's important to be able to stand your ground too. So somebody may say something like, well, I don't think that test is important. It shouldn't be in there, blah, blah, blah. And you could come back and say, we performed this test because this test is supposed to identify X, Y, and Z. In this particular case, it did not, but we're trying to demonstrate our clinical reasoning or our decision making in this process, and we would like to keep that information in the article. So once it's been returned to you, once you revise and resubmit, it then goes through the review process again, and that will continue to the point where it is either accepted or it is either rejected. If it's accepted, congratulations. If it's rejected, don't let that break your heart. Don't give up, because there's always another journal. And typically, there are tons of journals. So for example, just in the world of sports medicine or sports physical therapy, not all of the titles are related to sports physical therapy, but under the sports medicine umbrella, there's something like 75 journals. So there is ways to get your information out there. Publication process. So it goes through a final review by the editor, it's sent to the copy editor, they go through their production process and generate page proofs. The page proofs go to you. It's very important to review them carefully to make sure that they didn't make any errors or that they didn't edit anything out that you felt like should be in there. Now, most of the time they don't edit things out, but sometimes they'll edit some things out for overall space. And it's important for you to recognize if that's occurred. If it's something you really believe should be in there, then you need to make that argument as to why it should be in there. Now, taking a look at different ethical and legal considerations. Again, the patient is anonymous, so their confidentiality is maintained. But of course, if you want to include their images of any type, you need to get their consent for that and get them to sign a release form. There typically isn't any facility concerns that you need to be aware of. However, if you were to work for a business that had lots of different patient interactions going on, you'd want to make sure that no other patients were imaged in the background of any of those photos. And or if there was any private products or anything that your employer or that you didn't want to be out there, make sure that those weren't in any images or any materials that you submit. Now, when your paper is accepted, there's some different things that you'll have to sign, permission forms, potentially copyright releases, authorship forms, things like that, and that's something you can handle very easily at that time. Final tips. Even though you may be the only one treating a patient, consider sharing authorship with a referral source. So if there's a referral source, and if you go to that individual to gain any information, like I've gone and received medical records for information that I could put into a paper, you could consider sharing authorship. That could be a nice way of acknowledging the contribution of that provider, as well as starting to develop or maintain a professional relationship. Consider collaborating with a colleague. If your colleague has lots of great ideas or things that you should put into the manuscript, especially when it comes to talking about the theoretical framework or different references that you should include, then acknowledge that individual's contributions. You could also potentially collaborate with former faculty members, individuals that you may trust. And so why do I say this? Well, one, collaborating with a former faculty member could be good because those individuals are experienced with editing and writing and so forth, and they may be able to provide you help with editing and content. Now, what I would say is when you go to somebody, say, hey, remember me, former student, I've got this great case, I would love to publish it, I would love to see if you would be willing to edit it in some capacity once I'm done with the manuscript, and I'd love to share authorship with you too. And so let them know that, because if a case topic aligns with the practice or the classes that individual teaches or their research line, that can help them. That can help them, and as a faculty member, they have an incentive to do scholarly work. So if somebody came to me and it was in a topic area that I was interested in, I could potentially provide that editing, that mentorship, and we're potentially both helping each other out. So that's definitely something that you should or could consider. So here's my contact information. Hope you found this presentation helpful for you. I know it's some very dry material, but again, I think you as a clinician are in a great position to be able to contribute to the knowledge of the profession. So there's my George Fox University email, and I can also be found on Twitter. And if you're listening to this now, you've already found this presentation loaded up on YouTube. Best to you, and good luck with your patients.